my name is Eric. I'm a nurse and I'm here to discuss your diagnosis of diabetes. I'm going to share some information with you that will help you understand the disease and what your next steps are in managing it. Feel free to ask me any questions you have. First, diabetes is a disease that involves an imbalance between the metabolism and sugar. The body produces insulin to absorb sugar and uses it for energy. The imbalance occurs when the body does not produce enough insulin or the body does not react properly to the insulin being produced. There are three common types of diabetes. Diabetes type 1, when the body loses its ability to produce insulin. Diabetes type 2, when the body does not produce enough insulin and the body does not respond properly to the insulin being produced. And gestational diabetes, which is when diabetes occurs during pregnancy. You have type 2 diabetes. That means when you consume carbohydrates such as sugar, bread, beans, sweetened beverages, and tortillas, your body is not processing them correctly and you will have high blood sugar. Or if you do not eat regularly, you will have low blood sugar. There are health risks with both high and low blood sugar. This is a common disease that affects about 25.8 million Americans. Here in New Mexico, among the pueblos along the Rio Grande, 1 in 5 Native Americans 35 years and older have diabetes. I understand that you may not feel completely comfortable sharing your medical condition with family or tribe members. I would like to encourage you to share with a few close family members, however, so that they can help support you with this situation. I'll also share some community resources with you, but first let me explain a little more about the steps you'll be taking in managing your diabetes. Let's discuss what you will need to know to manage your blood sugar through diet, testing your blood sugar, and medications. Initial treatment of type 2 diabetes will depend on your specific needs. Your doctor will test your hemoglobin A1C, which is a test to check your average amount of sugar in your blood over a 2 to 3 month period. If your A1C is within a target range of 7.5 to 8%, lifestyle changes that include diet and exercise may be the only treatment you need. However, if your A1C is above 8%, medication in addition to lifestyle changes should be started. Your doctor has prescribed you to take metformin, 500 milligrams a day, with your evening meal. If you tolerate this medication without any problems, but your glucose levels are still elevated with your next visit, a second dose may be added for you to take with your morning meal. Let's talk about some diet changes you will need to think about. While you will not need to completely avoid culturally traditional foods, you should try to reduce portion sizes and decrease the consumption of red meat, sweets, salty snacks, and sugary drinks. Decreasing the use of solid fat such as lard or manteca and avoiding fried foods will also be helpful. Try to choose lean proteins like chicken or fish, non-starchy vegetables, and drink plenty of water. These are just a few simple changes you can do that will help make your overall health better. Your dietitian will explain more about this. Besides medication and diet, you're going to have to check your blood sugar before each meal and at bedtime to make sure your blood sugar levels are in the right range. This will involve a poke to your finger to get the blood and a machine called a glucometer that will be used to check the blood. It is very important for you to check your blood sugar the way your doctor is prescribing, especially as you are learning how to manage your diabetes. Tracking your food is a very helpful way to monitor what you are eating and how you are progressing towards your goals. You will have a whole healthcare team here to support you in those goals and managing your health. I'm setting you up with Indian Health Services. You may be eligible for a free glucometer and test strips, as well as additional resources through IHS. We will also set you up with a dietitian that will work with you and your specific cultural and personal needs for cooking and preparing your meals. Also, I'm making follow-up appointments in advance for you so that we can monitor your progress and make changes to your medications as needed. There are resources available in our community and online. Some of them include the National Diabetes Prevention Course through the New Mexico Department of Health. There's the American Diabetes Association online and the Albuquerque Indian Health Center. I hope I have been able to share some information that will help you and that you feel comfortable with the next steps you will be taking, especially with self-care. If you have any additional questions, I'm here to help you with the management of your health. If you don't have any questions for me, I will see you in a few weeks for your follow-up visit. Feel free to call the office at any time during business hours if you have any questions. We are more than happy to help you.